Perhaps I speak for everyone in saying that in an ideal scenario, having a child should be a matter of personal choice, not dictated by financial, legal, or medical constraints in particular. And it's in scenarios such as these that assisted reproductive technology, namely in vitro fertilization, has come to the rescue of millions of childless couples, enabling them to experience parenthood. And to shed more light on the subject, and more specifically the scientific, medical, emotional, and psychological aspects of the journey, I'm joined by a highly distinguished panel of domain experts. With that, I welcome you to our televised special feature, For Her, With Her. A campaign by Alembic Pharmaceuticals presents IVF and Infertility, Hope and Healing, in association with the Federation of Obstetric and Gynecological Societies of India and the Indian Society for Assisted Reproduction. Please allow me to introduce our guests. We have with us President of the Federation of Obstetric and Gynecological Societies of India 2022, Dr. Rishikesh Pai. Treasurer of the International Federation of Fertility Societies, Dr. Rishma Pai. President of the Indian Society for Assisted Reproduction 2022, Dr. Nandita Palshetkar. Director of the Ankuran Fertility and Fetal Medicine Center, Kolkata, Dr. Dibyendu Banerjee. And Medical Director of Nova IVF Fertility, Dr. Rohit Gutgutia. So Dr. Rishikesh, I'd love to kick off the conversation with you, and for sake of some context setting, over 25 million couples in this country that are actively trying to conceive are unable to do so. Does this, broadly speaking, constitute infertility?
Yeah, I think that in our country we have nearly 300 million people who are, trying in the fertility age group, and nearly 15% of them are infertile at present. And if you look at the definition of infertility, naturally the duration for couples who are in whom the wife's age is less than 35 is at least 1 year of waiting and trying naturally. And if you still don't conceive, then we call that couple an infertile couple. After the age of 35, it is just 6 months. And after the age of 40, you must try as soon as is possible. So recently there was a World Health Organization report where you will be surprised that the incidence of infertility has gone to 17% worldwide. So there's no difference between the advanced nations and the not so advanced nations. In all status of society have a huge amount of infertility.
Well, based on some of those observations, coming to you now, Dr. Rishma, what are the leading causes of infertility amongst men and women alike?
So let's start by saying that as many as 20% of couples have no obvious reason why they are infertile. They're just unexplained infertility. Even after running through tests, nothing is found. So there's that big segment which is unexplained. But other than that, there are many different issues. In the men, a simple semen analysis will tell us whether they have a low sperm count, low motility, because sperms are normally very fast moving. So low motility, sometimes we have an absolutely zero sperm count. And then in those men, sometimes we have to do further investigation as to why the sperm count is zero. Could be because of infections, could be the tubes which actually bring out the semen are blocked, or they could be born without those tubes. So there is a congenital condition where those vast difference are absent. So this is as far as the men goes. In the women, one of the commonest reasons is anovulation, basic hormone problems. You've heard of PCOS, such a common problem nowadays. So the egg doesn't come out as it should every month, and because of that, obviously there's no egg, there's no pregnancy. Another common reason is tubal block. In our country, tuberculosis is so common. Because of that, the tubes get damaged, there's a lot of things get stuck up, adhesions are there, and they don't become pregnant. Many other reasons. The uterus has multiple fibroids, there's damage inside the uterus, things are stuck up, adhesions inside the uterus, endometriosis, such a common cause of infertility. 20% of young women have endometriosis, adenomyosis. So lots and lots of such common conditions which may lead to difficulty in conceiving. And of course, age. Age is one of the most important factors, particularly for the woman. So if she's older, she's definitely going to have difficulty in conceiving.
Well, that makes for a great segue into my next question, which is to you, Dr. Rohit. So at what stage in a couple's attempt to conceive a child does it make sense to seek professional medical guidance? And at that stage, what are the tests that one can avail?
So as Dr. Pai pointed out, the couple needs to be trying for at least a year or so before they actually need to understand that this is now the stage where they need to see a professional doctor.
Sure.
If the couple, in the sense that if the woman is more than 35 years old, then she may seek professional help a little earlier, maybe at 6 months of trying. But they have to actually try for that 1 year's time and then go and seek a doctor. So that message has to be there, that you don't need to take a doctor's opinion as soon as you get married. So that's point number one.
Sure.
And as Dr. Reshma was pointing out, if we know the causes of infertility, then we know what all tests we need to do. Very simply put, you need to check the womb, so you do ultrasound. You need to check the egg reserve, so you do a blood test called serum anti-Mullerian hormone, that's for the female partner. You ask for a semen analysis for the male partner, and that's quite about the total package that you need to do. Obviously, you have to understand that reproductive health and general health are together.
Absolutely.
So you also need to check for the general health, like the thyroids and the sugars, they also need to be checked. So that would possibly give you a summary of the whole thing.
Well then, Dr. Nandita, building on what we've just heard, if it's been determined that a couple is in fact infertile, what are the treatment options that one can avail? I mean, I believe in vitro fertilization is the most talked about option, but it certainly isn't the only option.
Definitely. We look at medical therapies and we look at surgical therapies. You know, if they have simple problems like a hormonal imbalance, you know, like PCODs, we can give them ovulation-inducing drugs because they are not ovulating. So we give them those medicines and tell them to have intercourse. They conceive. If we have endometriosis, if we have fibroids, we can offer surgical options to them. You know, even surgery can be offered to people who have blocked tubes. So in those cases, the tubes can actually be opened by doing surgery. Then there is another very, common condition in our country, not in the country, actually it's being seen in the world, that there is a low ovarian reserve. There's a biological aging of the woman. Yes. You know, I mean, she may be 30 years old, but her ovary is like that of a 40-year-old. Now, this is something I want to bring to the attention of everybody, that a lot of girls are showing that, and that is one of the reasons of infertility that we are seeing in our population now. And this needs to be picked up because these girls need to be told that they need to get pregnant soon. So definitely there is medical treatment available, there's surgical treatment available, and there's a simpler treatment called intrauterine insemination. That treatment is what? It's conception of the baby within the body itself. It's not outside the body in the laboratory. So here we give medications, we make the girl ovulate, and we take the husband's semen and put it inside her womb. So what happens is the baby is conceived inside her body. So it's just a step ahead of natural. Absolutely. But of course it is done in an IVF center because now the law does not permit it anywhere else. It's a level 1 ART clinic.
Well, we've touched on age, but age aside, Dr. Divyendu, what is the impact of pre-existing conditions, be it thyroid disorders, diabetes, polycystic ovary syndrome, hypertension, on fertility outcomes, broadly speaking?
There is a paradigm shift in what we are eating. Our dietary habits have changed, our exercise schedule has changed, and we are more into studies, more into social media. So basically, as a doctor, we should counsel these patients and their parents about an active lifestyle, a weight reduction, which will go a long way in helping them to conceive. Not only this, polycystic ovaries is also associated with a higher incidence of insulin resistance. That means in future, they are more prone to develop diabetes. Thyroid is always there in our country. We get a lot of patients who are hypothyroid, that is, less amount of a thyroid hormone is produced in the body, and that alters the ovulation status, that alters the implantation rates and the pregnancy rates. And this is a very simple treatment. It is not a medication, it is actually a supplementation. We produce thyroid hormones in our body, and we are supplementing with that extra amount of thyroid hormone that is necessary. Hypertension per se is not a cause of infertility. Of course, these patients are stressed out. Their lifestyle is changed, and they are more prone to develop hypertension. That's it.
Well, coming to you, Dr. Rishikesh, there's so many myths and misconceptions that surround IVF, in vitro fertilization. Help us separate fact from fiction by breaking it down in layman language. What is the process?
In IVF, we go to the next step. You stimulate the patient with injections for 10, 11 days and produce, normally a woman produces a single egg, follicle. Instead of that, you produce multiple follicles and multiple eggs, and when they are ready, you just give a short anesthesia, and by ultrasound through the inside of the vagina, we with a simple needle we take the eggs out. It takes just 10-15 minutes. Within 3-4 hours time you can go home. Then you take the husband's sperm, process it, and then you mix the eggs and the sperm and keep them in the incubator for 2 days. Sometimes you can extend it to 5 days also. And when the embryos are formed, after 2 days we call it a 4-cell embryo, or after 3 days we call it a 6 to 8 cell embryo, or after 5 days it becomes 150 cell embryo, which is called a blastocyst. So you take 1 or 2 of these embryos in a small plastic tube, it's called an embryo transfer catheter, and you gently put it back. And now with the advancement of IVF, when I started IVF in 1990s, the success rate was 5 to 7%, but now over the years success rate has gone up by 1% every year, and now we are looking at a live birth rate of 30 to 40%, which is quite good. So just to put it in perspective, the natural pregnancy rate is 7%. We have gone to 40. We have increased the pregnancy rate by 400% in the last 30 years. So it's a phenomenal breakthrough of science.
You know, Dr. Rohit, the fact of the matter is that lifestyles have changed, with many couples now experiencing their first pregnancy when the woman is in her 30s. All right. So what is the impact of this delayed pregnancy trend, so to speak, on fertility outcomes?
So we are with the trend, we are with the theme of for her and with her. The situation is such that women are choosing career over marriage and family planning, and it's well respected and well understood by us. But unfortunately, as Dr. Nandita pointed out, the biology does not agree with that. So what we've understood of biology of humans is that humans do not reproduce very well. And we also reproduce in the earlier parts of our lives. So our body organs are such, and our gametes, the eggs and the sperms, are in good quality and top quality when the man and the woman both are in their 20s. So the moment you're choosing to delay your parenthood, your motherhood, you're actually testing yourself. You're taking chances, because as the age increases, the egg quality sets to worsen. Now, it doesn't worsen in that sense. What happens is women use up their good eggs earlier in their lives. So they're left with not so good eggs, which is why I'd like to bring in Dr. Nandita here, because she's one of the pioneers of egg freezing. So
Absolutely.
She might want to talk about this.
Absolutely. And I have a very pointed question for you, Dr. Nandita, in that, you know, egg freezing is so often discussed and it's becoming increasingly popular. Is this an option that you endorse as a medical professional?
I think it's something that is for her, with her. I really believe that it is very empowering to the girl. You know, when oral contraceptives first came, it really empowered the woman, because she had control over her body. And I think this technology is the second big thing after that, because it gives her control over her life. You know, girls are getting married late, as Rohit has said. You know, they are having their careers, they're getting educated. So what happens is the biological clock is going on ticking. Sure. So how do we stop it? There is no other way to stop it but to freeze those eggs. If they are not looking for a child before the age of 35, this is a wonderful technology which helps them.
Can I also just interject here that,
doctor.
you know, this technology can be used for other things like fertility preservation prior to cancer treatment also. So nowadays, if suppose, you know, younger women, there's a lot of cancer having in the community, and you know, talking about for her with her. This is also a very important support for women with cancer. So prior to they going in for cancer, chemotherapy and radiation, we freeze their eggs and freeze their fertility. And not only that, the men also. So if they have chemo and radiation, their sperm count can go to 0. So we freeze the sperms as well. So that's a big breakthrough in technology.
And to build on that, you know, I got a follow-up question for you, Dr. Nandita. Does infertility impact men and women equally? And what are the treatment options that men can avail? We've heard so much about what the woman can do. What can the man do?
You know something, Pooja? Actually, 50% of the time we do find that the man is responsible for the infertility. He contributes to it. 30% usually it's only the male factor. But do you know something? Before 1957, There was nothing called the male factor. Right. It was such a male-dominated field that there was no semen analysis ever done. It was only the woman who was responsible. Sure. But you know what was the side effect of that? That there's hardly any treatment for male factor. It's only IVF. And there is a surgery. If the man has varicocele, that means the testes has a collection of blood vessels which have become large and engorged. So that increases the temperature around the testes. The production of the sperms goes down. So we do a surgery and we reduce the blood flow. The sperm count improves fabulously. Yeah.
Well, Dr. Dibyendu, what are the success rates of some of the therapies that Dr. Nandita has just referenced?
Overall, if you see a cumulative success rate, it's always around 70%. The factors which are very important is, number one, the maternal age, the quality of the egg, whether the egg is already biologically old. Right. Next is the cause for which you are doing an IVF. If there is an adenomyosis, where the uterus is thickened, the uterus is not receptive to the embryo that we are pushing in, right, then the success rate is much lower. Sure. If there is an associated endometriosis, even then there is a change in the milieu of the womb, there is a reduced chance of having success. Right. So these are contributory factors which are there.
For countless couples out there, they have experienced IVF failures. It has simply not worked for them. So in cases such as those, are there any scientific breakthroughs out there that they can avail that, keep their dreams of having a child alive?
When we are confronted with a couple who has already had 3-4 failures, then we are desperate. Couple is desperate and doctor is also desperate. You try everything under the sun. And in the lab, there is a huge amount of new breakthroughs that have come. We have got different new culture systems that are available. We have got time-lapse technology where we take the photograph of the embryos every 15 minutes and then we can actually identify the best embryo. And now there's a new artificial intelligence which is incorporated in it. So the machine not only tells you which embryo to put so that the success rate will be higher. So, sure. And then on the sperm side, I feel that's where the breakthrough has come. So we can actually pick up better sperm. So we have something called microfluidics now where we can harvest better sperms, or we can pick up one sperm by magnifying the sperm. It's called the IMSI technique. And then we can inject them at the right time by looking for the spindle. So of course there are these, as I told you, there are a lot of controversies in this. But we try everything possible to get a pregnancy. And before I forget, the last technology which is quite prevalent abroad now in a lot of advanced countries like China and United States, the couples want first shot pregnancy. Doctor, no, I want it first shot. So they go for genetic testing of the embryo. So you can take the biopsy and test the embryo, and the normal embryo, you pick it up and put it back in.
All of this is very heartening to hear. And coming to you now, Dr. Rishma, all pathology aside, the decision to pursue IVF is of course deeply personal. So can you walk us through the finer nuances of the psychological journey and the emotional journey that a couple undergoes in the process?
See, any procedure which a patient has to undergo is going to induce some degree of stress in that person. But infertility is one of the most difficult situations which a patient sort of faces. So she's going through a lot of anxiety, depression sometimes because she's not conceiving. She's going through a lot of emotional turmoil. Guilt is there that, why am I not able to conceive? So there are a lot of things, and she can't really talk about this to too many people. Maybe she and her husband can share that. Sometimes even that becomes difficult. Interpersonal relationships become quite strained because of this whole process that they have to go through. And which is why, in fact, the IVF law, it's mandatory to give them counseling. So psychological counseling is mandatory to explain the procedure, give them support. So most important is to counsel the patient, to sort of handhold her through, to give her a good support system, whether it's the husband, her family, mother, sister, friend, and gently take her through the journey. And that helps a lot.
And I'll come to you now, Dr. Rohit. In the event of a successful IVF outcome, do those IVF babies typically require more post-delivery care? So,
as Dr. Pai was mentioning, this is now a 45-year-old technique, and more than 10 million babies have been born. So, we have to understand that ART patients, women who undergo IVF for whatever reason, there could be a reproductive health issue or a general health issue. But by and large, they are also 4 and 5 years older than the naturally conceived population. Right. And as you become older, pregnancies definitely become difficult to handle. So it is not the process of IVF or IUI or any such fertility treatment that is the cause. It's the age of the woman who's getting pregnant. That's the basic reason why these patients or these pregnancies are considered high-risk pregnancies. We call them high-risk not because they are high-risk. We call them high-risk because we want to give them special attention. And one of the reasons why we give them special attention is many of them end up with earlier than date deliveries, what we call premature deliveries. And then the babies are smaller and they need attention. But to assure everyone here, we have enough and more data through registries kept in many countries that as such IVF children or children conceived through fertility treatment are not any more or any larger amount more saddled with anomalies or diseases than normal population. So it's the same.
Well, Dr. Nandita, I think for a couple that's pursuing fertility treatments and IVF in particular, I think the value of a support system cannot be underestimated, right? So beyond one circle of friends and family, what are the resources they can avail? Whose doors can they really knock on?
I think that is a big problem over here. So basically what the law says is we do have a counselor. And there are some resource groups on the internet which are there, but in India they're not so popular, and we have certain reading material for them, but otherwise there's really not much that is really available in this country.
An area of much needed improvement.
Absolutely.
We'll walk away with that takeaway. And by way of closing comments, and I'll pose this question to you, Dr. Reshma, for couples that are potentially considering alternative approaches to building a family, be it surrogacy, be it adoption, how complex are these processes ultimately? And I know these decisions are deeply personal, but any more light you could throw on them would, I think, really help for sake of the benefit of our viewers.
Yeah. So before we go into surrogacy, just a little mention about third-party options, because we haven't discussed that. There are women who may be, for example, in their late 40s, mid-40s, 45-year-old, have no eggs left anymore, or a younger girl whose eggs have just diminished or finished, or who's had many IVF failures. The egg is not healthy. In that patient, we can offer her egg donation. Similarly, for the man, if he has absolute testicular failure, no sperms, even on a biopsy you get no sperms, then we can do semen donation for that couple. Even a ready-made embryo can be created and given or inserted inside the patient if both sides have absolutely insurmountable problems as far as the egg and sperm are concerned. So this is third party. And the other option, which is what you spoke about, is surrogacy. So obviously now we have a new IVF law recently come in, which is fairly strict and very clear about what can and cannot be done. Surrogacy for lifestyle purposes is not allowed in this country. However, if a woman, for example, is born without a uterus, there's a number of women who have something called an RKH syndrome. They're born without a uterus. They know from day one that they cannot have a baby. So that group of women definitely can avail surrogacy, which basically means if she has her own eggs, we take her eggs, we take the husband's sperm, we make the baby. So baby is biologically their baby, 100% theirs, and we just put it inside the womb of another woman who has been well selected, who's healthy, who's able to carry a baby to term. And there are conditions for all of this. The age group has to be proper, health has to be proper, and we have another woman help this patient by carrying their baby for them. Also, we have to never forget counseling the patient about adoption. It's a wonderful option. There are so many orphans, so many children there who need a family, who need a home. Of course, again, there are many rules. The age of if you're taking a newborn baby, for example, the age of the individual person has to be less than 50 years. Combined age has to be less than 90, husband plus wife's age. They also look at your physical, mental, emotional, financial health. So everything health has to be good. You should be able to look after. They will come and see your home. They'll come and, interview you. So make sure that you are an eligible person for adopting a baby.
Incredible. Well, Dr. Rishikesh, Dr. Reshma, Dr. Rohit, Dr. Nandita, Dr. Dibyendu, I have to thank you all for truly helping us humanize this conversation. Thanks so much for joining us.
Thank you.
Thank you.
Thank you.
Thank you.
With that, our special feature, For Her, With Her, a campaign by Alembic Pharmaceuticals presents IVF and Infertility, Hope and Healing, in association with the Federation of Obstetric and Gynecological Societies of India and the Indian Society for Assisted Reproduction comes to a close. Thank you to our illustrious panel for truly helping us humanize this conversation. We trust you found the insights shared of value. Thanks for watching.